this is a podcast obviously dedicated to the art, or I like to say more and more the science of storytelling.
Mhm.
But let's just talk about if sepsis is so pervasive and it is such a big killer.
Mhm.
Why is it still so unfamiliar to most Americans?
Well, that's a good question. I don't necessarily have the answer to that, but what I will say is, um, as I've been going down this path, this journey with sepsis, there's a lot of folks that I run across that have a loved one or someone that they knew that got affected by this. Many of whom have a very sad story about their friend or their family member dying. But the why it isn't out there more, I don't know. There's many groups that are trying to, nonprofit groups that are focused around sepsis, trying to get the word out there to help people understand it.
Is part of it that it's misdiagnosed? Is that part of the problem?
It is misdiagnosed. One of the other problems that our principal investigators had noted in one of our studies is there are these patients that they call patients who were otherwise masquerading as healthy. They're really difficult to identify, and they might have a fever, but or they might not be feeling good, but it's not really clear what's going on. And in many cases, if you've been into a ER in the last number of years, you generally get into triage within, say, 15 minutes of your arrival. The vast majority of those patients, unless it's incredibly obvious they have something wrong with them, if they're having a heart attack or something of that nature, they go back out into the waiting room. And the average wait in a waiting room in the US is 3 to 4 hours. That's on average. And the progression of the disease, which this is really scary, the progression of the disease is mortality goes up by 8% for every hour that a patient goes untreated. So if I'm a patient that goes in and I'm not really displaying all the things of sepsis in triage, I get sent out to the waiting room. My mortality rate has gone up to 30 or 40% just while I'm sitting there. And that's the thing we're trying to solve, is identify that patient actually when they're in triage. That this is someone you can't send back out to the waiting room. You need to get them back into the ED, the emergency department, as quickly as possible.